local and live. Covering Franklin and Washington counties, it's Let's Talk TriState.
Welcome to Let's Talk TriState, all powered by HomeRight Windows and Doors in Waynesboro, the right choice. Online, homerightwaynesboro.com. Joining us today from our friends at Meritus Health for our Ask the Expert segment, we have neurosurgeon Chkezie Eseonu. Doctor, pleasure to see you.
Thank you for having me.
It's wonderful to have you. I get very excited about Ask the Expert segments with doctors from various fields. I learn so much, and I think what benefits our viewers and listeners is that they may learn that it used to be, when I was growing up, if you were from around here, if you needed any state-of-the-art type medication, medical assistance, medical help, surgery, anything, it was you're going down the road to the big city. But everything has expanded and come home, and Meritus Health, we're so happy we have them here, has state-of-the-art, cutting-edge everything, and that all also is the case with your practice. Yes. So you're part of Meritus Health's neurosurgical or neurosurgery department.
Yes.
Okay. So take us through, as I have all of our guests do, a little bit of your history, where you grew up, where you went to school, anything that you're willing to share about how you got into your profession.
So I went to school pretty much throughout the East Coast here. So I went undergrad at Harvard. I went a medical school at Yale School of Medicine. Did my neurosurgery residency at Johns Hopkins in Baltimore. Okay. And then worked a little bit in Southern Pennsylvania, and then recently came down to Meritus. Okay. Ultimately, I got into neurosurgery because I liked the science. I was a student. I did a lot of research with drug delivery. That led me into drug delivery to the brain, which led me to interact with neurosurgeons. And then at that point, I fell in love with the field of neurosurgery. Okay. More so, you're always learning. The field's always learning something new, so it's never stale. And I think for me, that's what I'm very interested in. And, neurosurgery is always on my mind. So it's good. And in Meritus, we can kind of use that information and use that knowledge to help our patients locally.
Please tell me that you have a T-shirt that says "Neurosurgery is all my mind."
I do not, but that'd be a good T-shirt.
You have to get it. Trademark it and everything. I won't even ask for royalties. You just have to do it.
Great.
So we want to focus today on an issue that, as I said before, you used to have to go a long way to get anybody who had even heard of this, let alone able to help you. I'm going to attempt the pronunciation. Okay. And then you correct me, please.
Sure.
Okay. We have trigeminal neuralgia.
Perfect.
Is that correct?
Yes, it is.
Okay. So what exactly is that? And I hear that it is often mistaken for a dental issue.
Yes, so trigeminal neuralgia is a facial pain condition. It can affect one side or both sides of the face. Okay. Often presents as stabbing pain, either in the forehead, the cheek, lower jaw. Can be excruciating pain. Sometimes it's a dull, constant pain. Can affect people fairly significantly, and as you mentioned, it often required treatment first with medication management, often through your primary care neurologist. And if that wasn't working, that's when neurosurgery or myself would come and get involved, where then we offer a broad spectrum of interventions that fortunately now we can do locally here at Meritus.
Now, are you, what would your recommendation be for someone who says, well, I have symptoms that are similar to that, and I know we started by saying that this can sometimes be mistaken for a dental issue. Is it something where if you have those symptoms, would you recommend still going to see your dentist first if you think that it is in the, or is that something that you should see someone else for? You see why I asked that, because what do I do?
Yeah, absolutely, because one of the most common presentations is a lower jaw pain, and you can imagine you develop low jaw pain, you're thinking it's a tooth issue, you see your dentist. That's normally where most people start. I don't think anyone can kind of jump over that and say, oh no, it's trigeminal neuralgia. So you normally do start with your dentist. They may, do some intervention. They see cavities, they do something, or they say, we don't see anything here. Okay. That next step is normally either to your primary care or to your neurologist. They're the ones who are going to start you on some facial pain medications. That's the first line treatment for trigeminal neuralgia. Okay. They'll get some imaging to try to see if they see signs that also can lend to it being more likely trigeminal neuralgia. If the medications aren't working well, if you're having weird side effects with the medications, that's when the next step would be they would then send you to a neurosurgeon like myself, where we then offer additional treatment options.
So what is the medication does what? So what is happening in this condition? And then how is it? Is it medication? Is it a pain medication, or is it specifically designed to be a inhibit receptors or whatever terminology you would use?
Yeah. So the etiology or the origin of the condition is essentially you have a trigeminal nerve, which is the nerve that controls sensation to the face. It's become faulty. Sometimes that can be a result of compression, whether it's a blood vessel compressing on your nerve or some other mass compressing on it that is kind of withered away, or the shield or armor around the nerve has over time withered away, and now the electrical signals going through the nerve are faulty, and that can generate pain in the face. Sometimes it's just wear and tear over time, where for whatever reason you get 50, 60 years old, that nerve just breaks down and you generate the pain. But ultimately it's a dysfunction of your trigeminal nerve. The medications tend to be nerve-based medications. So they're trying to essentially stop the signal of pain from your brain responding to it.
Right. Okay.
And that's where, they're fairly effective. The literature shows they tend to be quite effective. But again, in those situations where either the medications aren't working, or they also come with some side effects. You're too drowsy, sleepy, you just can't function normally. That's when a type of surgical intervention would come into play.
Now, is this also the nerve that is affected by Bell's palsy? Are they related?
Not really. So Bell's palsy is normally affecting the facial nerve. So that's kind of the movement of the face. That's where you could get that facial droop. The trigeminal nerve is the majority of it is the sensation, your ability to touch your face, your ability to feel. That's the trigeminal nerve. There's a small component of jaw movement that the trigeminal nerve contributes to, but again, most of that's the facial nerve.
Understood. I love learning this. It's so easy to assume that that's the nerve. Well, that must be the catch-all for everything involving the face. Now, you recently, according to a press release here, treated a 95-year-old patient for trigeminal neuralgia. Take us through how that went for that patient, what you learned through the process. What was that like for you?
So as a 95-year-old lovely lady who presented with facial pain, a sharp stabbing, it was going through her cheek, going through her lower jaw. For years, she had been on multiple medications to try to address the pain. And like a lot of the condition, the medications worked for a little while, but over time it stopped working.
Right.
It pretty much nearly disabled her. She couldn't eat, she couldn't drink, chewing hurt. So she was kind of on a downward trend. And so obviously at 95, some of our interventions that we normally do, the open surgery or even an outpatient kind of injection procedure, she wouldn't really tolerate that well because, the anesthesia, just the risk for the procedures in general.
Yes.
So ultimately, we offered her radiosurgery, which we recently brought to the area. Essentially, that's where there's no incisions, no punctures, you're not put to sleep. We essentially, myself and our radiation oncologist at Meritus Health, will make a plan of focused radiation to that trigeminal nerve, essentially heating up that nerve, again, disabling that signal that's pain in the face. And so ultimately, it's a procedure. You come in, you're about here for an hour in our cancer center where we do the treatment, and then you go home after that. And so she tolerated the procedure very well, and on that road to recovery. But didn't skip a beat as far as her daily living and getting good response over time from it.
Now, this was not on my list of questions to ask, but I love how these questions bear themselves out as the interviews progress. When you are you essentially deadening the nerve? Is that correct?
Yeah, okay. That's essentially what you're trying to do.
Right.
You're trying to, at this point, the nerve is faulty. It's just not functioning properly. So you're trying to reduce that ability for the sensation, which now you're interpreting as intense pain.
Right.
You're trying to deaden or lower that signal.
So then my follow-up question to that is, since you said that this trigeminal nerve is responsible for basically the sensation that you would feel on touch, if the procedure is deadening that nerve, does the person suffer some paralysis in that area? Numbness, I should say?
Yeah, and that's a perfect distinguishing, because again, with the trigeminal nerve, it's mainly just sensation.
Correct.
So oftentimes either you can get your normal sensation with no pain, or you can develop a numbness in the area where you had pain.
Right.
99.9% of people suffering from severe facial pain take a trade-off of numbness versus some debilitating pain
Absolutely.
every time. So,
Yeah.
pretty effective procedure, the radiosurgery, again, maybe around 70% effective. It can take a little while to start working after your treatment. Normally it can be up to 2 to 3 months, although from time to time people get relief within a couple weeks.
Now, is this typically a one treatment, or is this a multiple procedure?
Normally it's one treatment, one high dose of radiation focused to the trigeminal nerve, which reduces any kind of radiation around your brain or surrounding areas. And if it's effective, can work up to 2 to 3 years. At that point, if the pain were to come back, your nerves are regenerating and that pain's coming back, we could always do that procedure again, which can, work just as effectively, if not longer.
So who's a good candidate for this radiosurgery? I know you said a 95-year-old wonderful lady who, now is hopefully living the best life that she possibly can, minus the pain, of course. But who's a good candidate to have that?
Yeah, so ultimately anyone who's failed their medical management could be a candidate for a radiosurgery. Oftentimes we restrict it to people who maybe can't withstand being intubated for a operation or a short procedure, or has some kind of medical conditions that would make those other interventions less suitable for them. I mentioned the other ones because we offer locally here 2 additional interventions, which is the open surgery called a microvascular decompression, as well as a trigeminal rhizotomy, which is an outpatient procedure. Still, you come in, you leave the same day, which are a little more effective in treating it in the more immediate terms, meaning you're looking at 85 to 90% efficacy or good results with those. They do come with a little bit of risk with the anesthesia related things and obviously with open surgeries, but they are also very effective for people depending on what your imaging looks like, how you're responding to certain medications.
Now, what are you, in those procedures, not the radiosurgery, but in the ones where it's an open incision, what are you doing in those procedures to the nerve?
Yeah, so, again, like I had mentioned earlier, there's damage to the trigeminal nerve. One of the things that could be damaging the nerve is that there's a vessel that's pressing down on the trigeminal nerve, often an artery, that over time is just beating on the nerve. At some point, the nerve just can't take that kind of trauma, and that's when the facial pain starts. When we see cases like that, the most effective treatment is the open surgery or microvascular decompression, where essentially you're now going to go make an incision, go into where the trigeminal nerve is, separate that vessel from the nerve with a little cushion, and then normally if that works, that can be almost curative, meaning you've taken care of the issue that was actually compressing the nerve, and it can last for 10 years, if not for the remainder of your life, as long as that cushion stays in place. Alternatively, if we find that you just have a faulty nerve, but there's nothing really compressing it, now we're trying to figure out how we can silence that nerve in a least or minimally invasive fashion. And that's where the trigeminal rhizotomy comes into place, where essentially we still put you to sleep, but you just get a little puncture in the side of your cheek, which allows us to take a little needle, go into the trigeminal nerve, inject something called glycerin, or burn the nerve. And again, that's silencing the nerve. Often can cause a little numbness in the place of pain, but very effective, 85 to 90% effective at taking care of that pain as well.
Now, I know that nothing gives you as good of a look as physically going in and seeing what you're dealing with in the operating field. But when you talk about the more invasive options, the incision and the decompression, is that something that you have a test or an imaging that will show you that that's what's happening there?
Correct. So, in that whole process of when you're first interacting with neurosurgery and coming in with, your medications aren't working, we do work you up a little bit to see what would be the best approach for you. And that's what's great about Meritus is now we're able to offer all 3 of those interventions locally.
Yes.
Normally, you'd either only be offered the surgery, and if the surgery wasn't good, you'd be sent off to, another institution an hour and a half, 2 hours away. But now you're able to get all of those interventions here locally. I'm sorry, what was the specific question?
Just you have imaging that will show you that it is compressing. So in other words, you and I are speaking and I'm suffering from this. You do imaging or a workup, as you said. Would you more times than not be able to say, well, Tiny, it looks like you do have some compression there. Is this something that you can see in the images?
Correct, yes. So a part of our workup, we do an MRI. It's a special scan that's going to allow us to fully visualize your trigeminal nerve.
Okay.
Then we'll be able to tell you, hey, there's something compressing it that we think we can separate or remove from around the trigeminal nerve, or we don't see anything compressing your nerve. So here are the options that we could do as far as interventions to try to help.
Is there anything that, and forgive me if this is a dumb question, but it bears asking, I think, are there any types of therapies that are more like a massage perhaps, or to move things around in there, or to, if we get a tight muscle, obviously we start to massage it and it begins to feel better and loosen up a little bit. Is anything like that exist for this?
Not particularly, and the main reason being because it's nerve-based,
right.
So essentially you're trying to attract the nerve or do therapies towards the nerve, whether it's decompressing it, radiating it, injecting, or burning the nerve.
I think that's why I asked, because primarily if it's being compressed, I didn't know if any of that type of movement might help that part of it. I should have been more clear.
Yeah, correct. And the trigeminal nerve, it's interesting because it's in pretty much the center of your brain, where your brain stem is. That's around where the compression takes place.
Oh, okay.
It then branches from that point and goes all the way out to your facial muscles for sensation. So,
okay.
At least from what we can touch and access on a day-to-day, we can't get to the point where we can actually manipulate anything to help with the face pain, just superficially.
Right.
Everything would have to be done internally or through a surgical procedure.
So now you said that you'll have an incision in the cheek, correct?
A small puncture. So the rhizotomy would be a small puncture through your cheek. Again, it's a Band-Aid. You don't see anything after that. The open surgery would be a incision kind of behind your ear, maybe about maybe an inch and a half or so behind the ear, and it's all within the hairline, so heals very nicely. You don't see it after the hair grows back.
Well, doctor, I could talk to you for hours about it. I find these things so fascinating, and I'm so honored and just pleased that someone such as yourself and a team that you have in Meritus, that we're surrounded by just these groundbreaking medical breakthroughs, that we don't have to go to Johns Hopkins, we don't have to go to Penn State. They're right here in our backyard. I grew up in Hagerstown. I grew up with the old Washington County Hospital, and it has now blossomed and turned into Meritus Health, which is just go there for anything that you need. And if you are how common is this condition, by the way?
So not very common. I mean, it's maybe 4 to 13 per 100,000 patients.
Wow,
you may see it often presenting after 50 years old.
Okay.
But sometimes a little earlier. There's a little bit of 20, 30s that may show it up as well. But not very common. Obviously, to me, who kind of deals with it daily, we see our great share of it. But in the general population, it's considered a rare condition.
Okay, well, we're glad, even though it's rare, we're glad that right here in our area, in Hagerstown, in Washington County, Franklin County, our friends and relatives and visitors can all go there and get the care that they need. We thank you for being here.
Absolutely. Thank you for having me.
The website where you can catch up with Dr. Chkezie Eseonu is at meritushealth.com/neurosurgery. We thank him so much for joining us on Let's Talk TriState. And as always, we thank you for joining us on Let's Talk TriState.
Let's talk TriState.
If you'd like to be featured on an upcoming episode of Let's Talk TriState, call 717-597-9200 or email letstalk@921thegoat.com.